It is now 11:01, and I really like to respect people's time. So Marty Solomon from our health department will continue to let people in as they arrive, but we'll go ahead and get started. It's so good to see so many of you here today, and I just will go over a couple of little rules first. Please remain muted. We have a lot of background noises and many people around us that are on their Zoom and meetings as well. We will have a question and answer period at 11:30 with our PeaceHealth guests. And so if you can save your questions until then, Marty can unmute you or call on you to unmute at that time to ask your questions. And just thank you all for being here today. Faith community leaders, nurses, and health ministers, I appreciate you and I look forward to getting to know you better. Thank you, doctors and nurses. Thank you, health department. Thank you, community leaders and members. What an honor it is to be in the same Zoom room with you today, coming together in this challenging chapter of our mutual history. My name is Sarah Lane. It's not in my Zoom screen. And I'm the new executive director for the Health Ministries Network here in Bellingham. In case you're not familiar with us, our mission is to train and support faith community nurses and health ministers to serve their congregations and community by promoting preventive health care, social justice, and spiritual well-being. So today we'll begin by just settling in, taking a moment to take a breath. Some of us are coming from busy days, so take a breath. And I'll let you know that we are very pleased to be able to host this webinar as we continue to journey through the pandemic together. As we begin, I wanted to read two short bits of information to set our tone of our meeting. The first establishes framework. The Department of Veterans Affairs compiled data that shows the 400,000 lives lost during this pandemic is more deaths than the number of US soldiers that died in battle during World War I, World War II, and the Vietnam War combined. Similarly, Johns Hopkins released information. The 400,000 death toll reported Tuesday last week by Johns Hopkins University is greater than the population of New Orleans, Cleveland, or Tampa, Florida. It's nearly equal to the number of American lives lost annually to strokes, Alzheimer's disease, diabetes, flu, and pneumonia combined. So we're looking at this framework. The second quote that I wanted to include, or bit of information, is by Dr. and author Atul Gawande. In the end, people don't view their life as merely the average of all its moments, which after all is mostly nothing, much plus some sleep. For human beings, life is meaningful because it is a story. A story has a sense of whole, and its arc is determined by the significant moments, the ones where something happens, measurements of people's minute-by-minute levels of pleasure and pain miss this fundamental aspect of human existence. A seemingly happy life may be empty. A seemingly difficult life may be devoted to a great cause. We have purposes higher than ourselves. And we have that, each of us today. All of you, leaders, caregivers, doctors, scientists, citizens, we have a purpose larger than ourselves. And so today we come together to address that. I'd like to introduce our first speaker today, John Mostalski, Manager of Spiritual Care for PeaceHealth. He'll be discussing what spiritual care looks like today during COVID-19. Thank you for being here, John.
Thank you, Sarah. I appreciate it. Good morning, everyone. It's a privilege to be here. And many of you I've met before on this kind of a call. And in some ways, I have to report that spiritual care hasn't changed much since we last met in September or over the holidays or anything like that. Other than here at PeaceHealth, we've increased our chaplain staff. Actually, I've done some more hiring, so we have more chaplains in the hospice program and here in the hospital to meet the needs of the patients and to make sure that we're caring for body, mind, and spirit, which is our mission, of course. Since the holiday season, the expected surge that our entire county has experienced unfortunately led to PeaceHealth to further restrict visitors. So currently we still do not allow visitors in except for very narrow circumstances. So that, of course, increases a lot of the need for human connection among the patients. So my team is doing a lot to use our virtual visitor program, using the iPads that have been resourced to us to help the patients connect with their loved ones at home and that kind of thing. So this is similar to what we did back in the early months of COVID. In a way, it's returning to that that period when we have not so many visitors allowed in our facilities. Beyond that, our census is fairly high with regular patients, not just COVID patients. I think today we have 18 patients out of 200. So only 18 patients are COVID patients here at St. Joseph. In our hospice program, we have also around 200 patients, both in the community, in their homes or in facilities, and about a dozen or so patients in our hospice house on the campus of the Whatcom Hospice. So that's a lot of folks being cared for by PeaceHealth here in Whatcom County, and it's a real privilege to be part of this ministry of helping care for them. Beyond that, I'll take any questions anybody might have at this time. Carol?
Yes, I'm wondering what you hear about vaccine. Your phone lines, I understand, nearly crashed or did crash with people calling to inquire. So do you have any information for us that we can give our people?
Right. So about the only information I know is what I've also read in the newspapers and heard in the press. So I'm not part of the vaccine team, so I don't have any clear knowledge on that. I know in general, the PeaceHealth Medical Group patients, which are about 60,000 in Whatcom County, are being called by their providers to make appointments. And what one messaging that went out apparently was asking the patients to call in, which led to that horrible surge of, I think, 30,000 phone calls in a matter of a couple of hours, which shut down the whole phone system. So that's just what I heard and read in the papers and things like that. So I know at our health education center, which is on the far edge of campus, we've converted that entire facility, including the spiritual care learning center, into the vaccination center, which will allow about 500 people a day to come through there and receive vaccines. And we plan on staffing it 6 days a week. So. Father Moore, my pastor.
You mentioned there are still narrow limits in which there are visitors that are allowed to visit. Just for our own information as pastoral ministers and maybe people working with people who have loved ones in the hospital, what are those narrow limits?
So if, visiting clergy and folks who have registered through my office in terms of being able to visit folks in the hospital are not considered visitors. You're essential personnel, and so the restrictions don't apply. So it's just similar in a way. The restrictions that we've always had around COVID and COVID patients are the same, but the visitation has not changed. So we encourage most visiting clergy to do virtual visits as much as possible, but we do allow in-person visits for those rituals that require physical presence.
Thank you.
What about faith community nurses?
Faith community nurses are not paid clergy, so they are not part of that essential personnel, from what I understand, as far as how that was made.
So if their congregations chose to pay their faith community nurses, which some congregations do, not so much here in Washington, but in other parts of the country, would then they become eligible to be on your list? Or what's your thoughts on that?
It's up to the pastor to decide if those are the people that they want representing their church and allowing them to come into the hospital to provide spiritual care. Yeah. So if a pastor writes me and recommends, certain members of their staff, that's how I take it. Yeah. Alrighty, well, I'll put my contact information in the chat. If anybody wants to reach out to me by email or phone, feel free to. Appreciate all the support, and we all look forward to a day when we can see each other in person and be able to do a lot more of this ministry. Especially so much of our spiritual care ministry involves a type of intimacy and healing touch and the ability to be so close to people. So when physical distancing is being encouraged, even as chaplains, we really struggle with that. But we're finding other ways for the Spirit to use us in this ministry, as I'm sure you're all doing as well. So thank you, everybody.
Thank you very much, John. I appreciate you being here and making yourself available for questions. Once you have his contact information, you all can continue to communicate with him and ask questions as they arise. I'd like to introduce Dr. Gober, I hope I pronounced that correctly, from PeaceHealth. She will be talking about key updates on what we know about COVID-19. And we look forward to hearing what you have to say. Thank you, Dr. Gober, for being here.
Great, thanks for inviting me. So I am what we call the chief hospitalist at PeaceHealth, and I supervise a team of about 25 physicians and 3 nurse practitioners. And we have just keep plugging away through this. As far as data, I would like to lean on Marty from the health department. I do have the dashboard up, but I think a few key points are like our case, we are quite high. I had, when you look at Whatcom County compared to the rest of the state, we are much higher than the rest of the state right now. And I say that just as a reminder, even to myself, that we still have to use our same precautions, even though as some frontline workers, we are vaccinated, we're still using masking and distancing and hand washing, etc. But I'm going to pause just for a moment. And Marty, are you able to share these dashboard numbers?
I am not. Allison, are you? Let's see. Or Anne?
I can share that from last night. It said the confirmed cases in Whatcom County were 5,231. And we've had 253 hospitalizations and 59 deaths in our county. The number that I am struggling to find, but I was looking at last night, is if you take the number of cases we've had kind of on a rolling 2-week basis, and then you say per 100,000, you do scale it in that way. We've had, if my memory is serving me from last night, we have 494 people who have been positive in per 100,000 of our residents. And that is higher than the average in the state. I think the state was around 430, 440, but what I can tell you as far as what may be on many people's minds, something I'm getting a lot of questions about is, have we seen these new variants yet? The British variant, the Brazilian, and the South African. And I know that as of yesterday and the weekend, the British variant is nearby, if not here. Northwest Labs tests for that British variant that is more contagious and more easily transmitted from one person to the next. And in their lab, they have not detected it yet. I don't believe, though, that and I could be wrong, so correct me, Marty or Allison, if you can, that the lab that is inside of PeaceHealth itself, I don't believe they're running that same genetic screening, the same testing. They're running and saying, yes, this person has COVID or no, but not necessarily that detailed level of testing. My sense about it is it's only a matter of time, just like everything else. It will be here. And as a healthcare provider supervising these people who directly go in and care for these patients all the time, it makes me worried. I'll just be very upfront about that. Not that I'm not worried in this moment that we can't manage the people, but I think there is this pandemic fatigue that we all feel. And so again, I'm going to circle back to it's all the more reason to sort of double down on our efforts, whatever we can be doing to prevent transmission. I just implore all of you and to communicate to everyone you're involved with to keep it up, and eventually we will be through this. I think I'll pause there and invite questions.
I have a question. Dr. Grover, I was listening to my parents' discussion from Cleveland. They went to the doctor yesterday up at the hospital, and the doctor advised them that they should wear multiple masks at the same time for the new COVID variants.
And my father told me this very question, actually.
Are there any additional precautions that we are considering regarding the new variants?
That is an excellent question. And I wish I could say that I have evidence behind the double mask. It logically makes sense in my brain, but I can't say that I had evidence about the double masking. And certainly if others have, please feel free to chime in. The best thing would be what we have over 100 years since the flu pandemic known to be true, which is the three things of physical distancing, wearing a mask at all, and hand washing. So if your parents, I did encourage my father, who is currently undergoing some physical therapy, and he said, gosh, when I go to that physical therapy office that's pretty small, and they want to know if they can have a student come in too. And he was an educator. He taught high school for 37 years. He said, I'm always a sucker for that. And I said, Dad, right now, I think it's okay to say one person in that tiny room with you and is plenty. And you will go back and you will have other times in your life when you can provide that educational opportunity. But right now it's not essential. And so, and you're 80. So we need to think in those terms.
I appreciate that, Dr. Grover. I think that encouragement to speak up, to say what we're comfortable with and what we're not, is good encouragement as well. Thank you.
I was wondering, there was the mention that the education center has been turned into a mass vaccination site. Earlier this morning, I was listening to public radio, and they were talking about Bellingham, and other cities, rolling out or putting together the mass vaccination site. Is it, to your knowledge, is that going to be the county mass vaccination site, or is it mass vaccination for patients of PeaceHealth, or who would be served there?
That is an excellent question, and I don't know the answer. And I'm wondering, Marty or Allison, do you know either? So my initial understanding is that so Pfizer came out first with their vaccine, and that required that ultra cold storage. And so there were only a couple of places in the county that had that kind of refrigeration. So PeaceHealth centrally became one of those sites, and was in that way teaming with the county to provide all essential workers, including first responders, et cetera, in those vaccination efforts. As far as the broader, now they've moved out of the hospital setting and to the health education center. And my understanding was that was going to be a PeaceHealth effort for PeaceHealth Medical Group. But I feel like I've heard conversation, and I'm not on the vaccine team either, so I apologize that I don't know. I see Ann Beck. Do you?
There's actually a vaccine planning meeting happening now, so I don't have all the most current information, and I'm new to the group. So but I will say that the health department is part of the conversations with providers who are vaccine. Who are able to provide the vaccine to the community to figure out how to kind of stand up larger clinics when the time comes. I do believe that the PeaceHealth effort is currently just focused on the PeaceHealth population, but that's not to say there won't be a time where it builds on from there. But I mean, the continual challenge is we just don't have enough vaccine in the community. I will say I get contacts from all sorts of folks who want to know where the vaccine is, or if anyone's kind of holding on to the vaccine, and they're not. It's going out to the tiers as they should be, and we just don't have enough. But that doesn't mean we're not planning for when we do have enough to go out to be able to stand up those larger clinics.
Mm-hmm. One more thing I can tag along to that is, I know that part of the distribution of the vaccine was they wanted, my understanding is the government wanted to send the vaccine to places where they had it kind of dialed in nicely and could be efficient in getting the vaccine into people's arms. And I know that PeaceHealth demonstrated in their hospital in this effort to get essential workers vaccinated. They reportedly did an excellent job in demonstrating that they have a process and procedure for getting a lot of vaccine out. So that provided some optimism. The issue really is, like Ann said, the supply. It's just not here to be distributed. So I know also Family Care Network got a small amount of Moderna and sent out an email to all Family Care Network patients stating that they would be contacted when they had their vaccine clinic figured out. So that's in the works as well.
I was just going to follow up one time, because as we were speaking, we got an email from our communication specialist. It sounds like King 5 reported that we were working with Bellingham schools to set up a mass vaccination site. It's not the case. We're working with all of our partners to figure out how best to get the vaccine into the community and how we can be supportive, and looking to make sure we're also doing an equitable distribution, looking at vulnerable populations, and then also how to partner with folks like you who have your fingers on what your own communities are needing too. So there's continual planning happening, and we are trying to get the information out as we have it and as the vaccine comes in.
And I would
But we're
just
not
add,
standing up a mass vac site right now. Go ahead, Allison, sorry.
oh, I would just add on to, as all of these plans are rolling out, I'm Allison Williams, I also work at the health department, and that all of these community partners and enrolled providers are working together really closely and cooperatively in terms of prioritizing the folks that are eligible to get vaccine, that they get the vaccine that we do have. And I've been very impressed with how well everybody is working well to just as quickly vaccinate the community as we possibly can. And the main holdup, as Ann said, and Dr. Gober said, is the lack of adequate vaccines right now.
Once we do get more vaccine, have you considered using churches for mass vaccinations?
I know I've heard from folks that have been interested in offering that. So I've shared that forward with the folks who are doing a lot of the planning. So I think it's definitely being considered. They're looking at all sorts of spaces.
Have you established any criteria for people that have a history of anaphylactic shock? We've all been sitting back. I'm one of those, and two of my nurse colleagues are in that category. I've heard that the Novavax that's coming out might be more appropriate, but I don't know.
We'll have to see on the Novavax. And the recommendation from Pfizer and Moderna is that if you have a history of anaphylaxis, to check in with your primary care provider, or if you have an allergist, allergy immunology physician, to check in with those providers prior to receiving the shot. In the vaccine clinics that I have seen and been part of, they have a very well thought out monitoring system and with a crash cart there so that you can receive immediate therapy if you have a reaction. The recommended amount of time for you post-vaccine to be present and waiting to see if you have a reaction would be 15 to 30 minutes, for you probably 30 if you've had a full-blown anaphylactic reaction before.
Thank you.
Mm-hmm.
Is the health department still needing volunteers to help with, to sign up to help with vaccinations or assisting in other ways?
But I can't say I know for sure. I will say that I did reach out to our own operations staff and said that I'm in a place where I could be more available if they needed any frontline support. And I was told that they're pretty good right now. They streamline things pretty well. I think that if you are interested in any kind of volunteering, I always direct people to the Whatcom Unified Commands volunteering website. You can apply there and put down what your interest might be. And then when it comes time for volunteers, they often look there for that. So I don't know, I can pull up that website unless Allison's doing it right now for Unified Command, but that's a great place to start if you are interested in volunteering.
Yeah, I'll drop it in the chat. Yeah, that's where we've been directing people to. I'll drop it into the chat.
Thank
Yeah,
you.
do you know if you're holding back doses for second doses, or how are they handling the scheduling of second doses for the health providers? Probably now, just the caregivers and the nursing home residents and staff.
Go ahead, sorry.
Yeah, nursing home residents and staff are actually being vaccinated through CVS and another major commercial pharmacy. I'm blanking on which.
Walgreens, maybe? Walgreens.
That's what I was thinking. It was Walgreens. Yeah. So they're separate actually. What I was told on a larger call recently was that they were not holding second vaccine doses. So they were vaccinating as many people as quickly as possible. And basically with the understood risk of the supply chain. But so far I've not known of a first, someone who's received a first vaccine without being able to receive a second one. So.
Nurses and health ministers, this is Sarah, and I just wanted to remind you that we did get an email from Molly in communications at PeaceHealth requesting volunteers for vaccination clinics. These are both for nursing positions as well as for administrative, meaning working on the paperwork, sitting with people who have just had the vaccination and otherwise assisting. So nurses will have the opportunity to vaccinate, and non-nurses can assist with that. So I'm going to drop the link to the PeaceHealth volunteer form in there as well, because they did call on us earlier this week and that's been sent out.
Great. I just want to check in for any last questions before I have to log off. All right. Well, thank you very much for everything you all are doing. And thank you for allowing me to be here and connect with you. I appreciate it.
Thank you very much, Dr. Gober. We appreciate your time today, and it was wonderful to hear from you. Great. We are at 11:32, and we've had some questions for our speakers intermittently. Are there any questions before we go ahead and move on to our faith community leaders, Father Moore from Assumption Catholic Church and Ron Schultz from the Seventh-day Adventist Church? Any questions? Okay. Father Moore, may I call on you to speak at this time?
Certainly.
Thank you.
As I understand my prompt, I'm talking about pandemic fatigue and how different communities are addressing that. Is that correct?
Yes, that is.
Great. There are two groups on my mind. The biggest one, and I'm sure all of you are thinking about them as well, are those who are in assisted living facilities. This is the group that we've particularly struggled to serve. As churches gray demographically, this is a larger portion of our community, at least. And for many of our most faithful parishioners, I haven't seen them for 10 months because they can't leave their residences and be admitted back in. So we particularly have been struggling with how to reach out to these folks. We've been doing phone calls, we've sent a letter, but because they struggle to stream online services and because they struggle to be connected to e-newsletters, we're continuing to have problems with that. If anybody has particularly effective programs, I would love to hear from you on those. The other thing that's happening, at least in our community, is the Catholic Church is in an odd space because we have sacraments that theologically have to be done in person. We can't take everything online all the time. You can't receive the Eucharist online. So we have a dictate from the diocese, our regional body, that says we can continue to have services that are sacramental in nature in person. So we're doing the Mass and confessions and such things in person, while all of our other programs that can be taken online need to be taken online. So we have a hybrid model that a lot of communities may not have for different theological reasons. What we find for our people, even though they can only come to Mass once every other week for capacity reasons, is that ability to get out of the house, even if they're distanced with masks on, even if they can't socialize afterward, has been very helpful to addressing their fatigue. Because as I hear from people when I talk to them once every 2 weeks, all the days blend together and they need some focal point. If you don't have in-person services, my best recommendation is simply to have something that differentiates something during the week, something that people can look forward to. We find that very helpful for our folks. I don't have any great answers. I just wanted to provide the prompt. If anybody else has other things to add after, I think Ron talks to us. I'm sorry, the last thing I'll say is there's another thing that I talked about with the group organizing this meeting. In the Catholic Church, there is a particular question with vaccines about abortion-derived cell lines if you need resources on that, we continue to encourage our people to receive vaccines, even those that we would find ethically problematic. I have some good documents and some good teachings on that. If you have people bringing that up to you, if your denomination or community has problems with that, I'm happy to work with you. I've done a lot of work on that myself.
Thank you very much, Father Moore. Would it be okay for folks to contact you by email for that?
Absolutely. I'll put my email in the chat.
Thank you so much. I appreciate it. Rather than ask any additional questions right now, I was going to ask Ron Schultz if he's available right now to add to this discussion.
Yeah, thank you for the invitation to share. Let me kind of sketch for you what's been happening in our congregation first. Back in June, I actually served two congregations, one that is elected just to continue to do it only virtually because of unique health issues that smaller group meets. But my Bellingham Seventh-day Adventist Church, which is out on Smith Road, right across from the soccer fields, it elected to very carefully begin to do in-person services back in June. And then I think it was about September, we introduced our children's ministries back very carefully. About 2 weeks ago, as we saw the numbers really spiking, we had a special Zoom board meeting, and it was a difficult decision. But my frontline people were really encouraging us to take a break for a while, particularly when I'm hearing from frontline people that the only reason they're coming is out of duty to help care for others. So we have suspended services starting last Saturday. Our services are on Saturday for 3 weeks, just seeing how things go. So we decided to just take a break. We did continue our children's ministries because we can put them in much smaller groups and less risk for them. So I just wanted you to understand the context. The messaging on that, Anne asked me to maybe address a little bit of messaging. It's very challenging when you have such a polarized view of the whole COVID virus thing, the full spectrum here in Whatcom County. Obviously I had people that were very disappointed on both sides of this. There are people that are very supportive on both sides of this. So here's what we're doing, and we have been doing, to minister to those who are still not feeling safe to come out. Following our YouTube streaming every week of our service, for those that don't come in person, we actually have a virtual sharing time right away on Zoom. And it's a small group, but they get together right after the service, about 15 minutes after that. It's a time of shared fellowship, prayer together. That's been absolutely critical. Then on Wednesday evenings, we also have a virtual time of prayer and fellowship. Sometimes we have study. We've had guests from the community that have come on and joined us so that we can keep kind of an outward focus, how to continue to support and pray for the community. We're presently doing a 6-night Zoom virtual spiritual renewal time for our congregation, trying to provide this. We have a somewhat tilted toward elderly congregation, as I'm hearing Father Jeffrey saying as well. And for them, even though sometimes they're counseled by their family members not to come to in-person services, this is the only really social connection they get. So we're just trying to provide a sort of a broad spectrum. One last comment about what we're doing to deal with fatigue is that we have some really remarkably gifted individuals in our congregation, unpaid staff, who just are really faithful at reaching out. There's a lot of congregation to congregation care that's happening, people reaching out by texting, calling. But I'm really seeing the fatigue. Now I'm sending texts, reaching out to people, and they're not responding anymore when they once did, which really has me concerned. So just this window right now is particularly challenging because we're pulling back from in-person services.
Thank you very much, Ron. I appreciate your sharing your experience with us, and Father Moore as well. We have a number of health ministers and faith community nurses here today, as well as other faith community leaders. Before we go into the Whatcom Community Health Department time to talk, I wondered if any of you have particular things that you are doing to address isolation and fatigue right now. Is there anything working for you, anything not working, and anything you want to ask about in this forum?
The thing I'm doing more than maybe some others is doing grocery shopping and things for some of these people that are homebound. And I think there's a need for some of those things that probably just isn't met in the community.
I'll just mention too, I'm Pastor Jana Schofield from Christ Lutheran in Ferndale. And we have Stephen ministers in our congregation who call the congregation once a month, everyone in the congregation, just to check in. And then I check in with them and make follow-up calls and to those who need it. We're going to pass out to our congregation Lent packets with Lenten devotional and even a little packet of ashes. We're as different from Catholics, we're not as, even those liturgical rituals are not as important to have a clergy person be a part of, but we are going to do online Ash Wednesday and Lent services and that kind of thing. So just reaching out. And the other thing that's actually been kind of popular is I'm doing a Friday at 4:30 hour-long happy hour on Zoom, and some people have loved it. So happy hour is an idea.
Well, at First Congregational in Bellingham, our pastors have a prayer line, and you can call in, and they publish the number, and you can just speak with a pastor and have a prayer just for you, and that's been helpful, I think, for people that have been isolated. Our Call to Care team is within the church, all the people and organizations and committees that do things for people, including grocery shopping, including delivering meals, including, helping get meds from the pharmacy. Although it appears that need has gone down because people have figured out how to get groceries, delivered to the house, and the pharmacies have been good about making deliveries. So we're not doing as much of that now as we were. So, it's just trying to figure out what people really need, and then, making trying to make those connections. This is helpful to hear what other people are doing. Thank you.
We will continue as Health Ministries Network to have this conversation. We have a Faith Community Leaders Lunch coming up on February 11th. Faith community leaders will be invited to this, and also to show ways in which faith community nurses and health ministers can assist in the mind, body, spirit care of faith communities. So stay tuned, because we've got some really creative individuals who can find ways of connecting. Window visits. Yes. All right, I will turn this over to the health department then. Updates and next steps from our county health department. Thank you, Allison, Marty, Ann, for being here.
Allison had to step away for a minute. I think I see Kelly and I see Julie and Julie
okay.
on here as well, who are some of our public health nurses.
Thank you, Kelly.
So they came on to be able to offer any insight or answer any questions you might have as well. I didn't prepare anything too formal. I am curious to hear, because I always like to get this information for myself, of what are some of the ways you handle some of those challenging conversations with folks if they're not wanting to wear a mask, if they're not necessarily buying into the prevention strategies that are in place. Part of the reason that we kind of wanted to talk this through a little bit is to get some insight into how we can be a resource and an asset to the community, the faith community. There have been some pockets of COVID that have come sometimes in places where the churches might not be totally comfortable, might not be totally on board with the masking and things like that. So we just kind of wanted to get some ideas from you on what those conversations might look like, or how we can be a resource to the faith community as well. So I'll put that out there for you to kind of noodle on a little bit, but I also want to make sure that Julie and Kelly have a chance to to respond to any questions or share any insight they might have as well. Just put you both on the spot like that. Does anybody have any? You've got your very own nurses, right? Well, you probably already all have your very own nurses, but you've got some Whatcom County public health nurses here for you if you got any questions.
One of the questions I had, just because I called a couple new moms yesterday, is there anybody's specialty, because OB is clearly not my background. Is there anybody's specialty in the health department that could do follow-up calls for new moms?
This is Kelly. Like was said, I'm one of the public health nurses. I know that there's anyone specifically at health department who has an OB specialty. And typically, if there are questions surrounding COVID and pregnancy or postpartum, our nurses would most likely direct them to their PCPs or providers to have discussions on and answering any questions that they may have.
Okay.
A lot of our nurses, we're segregated into different groups depending on our roles. Like I am one of the data and surveillance nurses, so I have proverbial fingers in all the pots, checking all of the systems and watching all of the cases coming and going and trying to identify clusters and outbreaks. We also have a team of nurses who are more likely to field some of those calls in our quarantine and isolation groups, who are dealing with people who have either been exposed to someone with COVID and are instructed to quarantine, or people who have tested positive for COVID and are being requested to isolate. So we will tend to field some of the basic questions, and anything that's a little bit beyond the scope of nursing, we direct to the provider.
I just wanted to add, we do have our family nurse partnership nurses, which the majority of our staff has been designated to COVID, no matter what our prior roles were. But the family nurse partnership nurses still work with families of vulnerable populations, and they do follow them for a 2-year period. And they're just now beginning to integrate that program back. And I'm not exactly sure if they are doing home visits at this point. I know it was Zoom up until a couple months ago, but we could certainly hook people up to the right resources. And being that we all are RNs on this staff, at least for the CURT nurses and us surveillance team nurses, we can certainly designate you to the right resources.
Thank you.
Yeah, those CMAR Community Health Center also operates our maternity support services for new parents, and I can put a link in the chat to some of the resources for new parents. There also is a warm line for just moms that may be struggling. There's a warm line through Perinatal Support Washington, and they have peer support leaders and resources for folks both in English and Spanish, and also for new dads. So I can put some of those resources in the chat as well.
Thank you.
I will say, to piggyback on what Dr. Gober was saying earlier, although we saw a very dramatic spike, of which none of the neighboring counties really experienced after the holidays, we have seen encouraging news the last few days with lower case rates. I knock on wood, I feel like it's a little too early to say anything more than that, but we are hoping that the trend is going in the right direction. And I do think that that reflects on the difficulty of the time surrounding the holidays. Especially in this time when we feel so isolated, those traditions that we want to uphold and see family members, that is, that's definitely directly related to a lot of the increase in cases that we saw, and that just speaks to the challenges of the time.
I have two things that I know for me have been helpful in getting through this. I think early on in the COVID response in like April or May, when I thought I was tired of it, that was light years ago, and boy, are we tired of it now. I came across a blurb about Margaret Mead, the anthropologist, who talked about the way you can tell the sign of a civilization. The first time they could identify signs of civilization was when they discovered an animal bone that had a femur, or a human bone that had a broken femur and it had healed, because it was a sign that their in the animal world, when there's a broken femur, you're left to die. But in the human world, when they saw that, it meant there was somebody who was caring for them and came back and gave them the water and the food and the care that they needed. And so for me, that's been kind of what I come back to when I remember why we're having the hard conversations and why we're doing these things, is because this is us caring for those who are more vulnerable, who aren't able to get the care they need. And I know you all know this because of the work that you do, but I think for me, that's been kind of a centering point. And then my really short mantra of that all the time is just, we can do hard things. You know, I just say that over and over. We can do hard things. I forget it, and things can be really easy, and you forget that you're able to do it. But I tell my daughter, we can do hard things. So I just ask that you continue on behalf of the health department, just to continue to work with your own communities and remind them they're phenomenal and they do such a good job of taking care of each other. And that's why we're doing these hard things, is to take care of each other. So those are my 2 cents. That's my inspirational speech for the day. Father Moore's seen me on my meetings. I like to get philosophical sometimes. So, but I do want to make sure that you all take advantage of, if you've got folks here who can answer questions you might have or information you can share.
I have a question. I had to step away for a moment, so maybe you all discuss this, but Ron Schultz was talking about just reaching out and not having people reach back, and just wondering about how you're staying connected with people who the internet, either they have limited access or it's doesn't fall into their skill set to get information that way, or use Zoom. Do people join by phone? It sounded like you have congregations often have volunteers that just like a phone tree and pick up a phone to stay connected, but was having a conversation with someone at the senior center, and she was letting me know the number of folks that really don't use the internet as their primary way of getting information. They like to get it in the mail, and how you're staying connected with those people and how we might support you in connecting with those folks.
Well, those are the folks that read the newsletters that we send them and the newspapers that they get, from hopefully their subscribers, because so much of the work that we're doing now is either on Zoom or some other social platform. And that's how our church services are delivered, I think, almost all throughout the county. And a few churches are experimenting and have been meeting online, as we found out. I mean, in person, as we found out. But, we don't know exactly how people want to get their information either, and we don't know what we don't know. So that's a challenge for all the congregations, just to try and figure that out.
Allison, I'm sorry. I just want to add a couple of things to that. Before I took on this position, I was working as a director of family ministries for our church. And of course, it was quite divided, a lot of different perspectives on what we should be doing. And we did try to meet as many needs as possible in the safest way possible. Around the holidays, when we didn't hear from some of the folks who were most isolated, we delivered things to their homes and stood 6 feet away and knocked on the door. So going to that was helpful for people and reinvigorated. It wasn't something to be done every week, but it was something that did reinvigorate them to respond to the text or the calls or whatever. And just seeing a human face through a window or from a distance was helpful. And then the other thing was, there has been nothing more successful than connecting youth with older adults. Obviously, we don't do this in person, but we have a love letter writing, preparing things like that is very welcome. And so I know that Aging Well Whatcom is doing that as well. They have a program going on. I don't know if Tessa wants to say anything about that, but giving people a purpose, young people, and people of all ages, that purpose to keep connected with one another. And then the last thing is kind of adopting families, adopting families within faith communities to know that I'm not going to check on everyone, but I am going to call this one person regularly and make sure that they are cared for intimately in a responsible way. So that's what I have. Thank you.
So for Hope Lutheran, can you hear me okay? Yeah. So we have all the congregation was divided up and everybody was given about 3 people to check in with. And then Judy Johnson, who is a health minister, she has sent like thinking of you cards and stuff to everybody in the congregation. So she's done a lot of mail, which a lot of people really appreciated.
I just want to share a couple more next steps with folks if they're interested as well. I'm going to put my email address in the inbox on the 3rd Friday of every month. And I think we're going to be increasing our frequency, but I have a community and faith-based partner meeting. It's fairly informal. But we usually are talking about maybe resources that might be available in the community that you could share out, whether it's rental assistance, food resources. And we can also, at that time, when there are updates that are worth sharing about COVID or vaccines, we share those there as well. And it's a time for those attending to ask any questions they might have of us. And I've gotten so good in this job at saying, I don't know, but I'm going to find out the answer to that and get it back to you. So I'm not guaranteeing you'll get your questions answered that day, but I can definitely take them down and get them back to you. So I'll put my email address in the chat box and you can email me and let me know if you want to be added to the list and I can add you to that list. And it's usually about 2 o'clock on the 3rd Friday of every month. So, and then I feel like there was one more thing I was going to share, but I can't remember what it is now. So I'll kick it back over to Sarah.
Thank you very much. I appreciate everyone being here today. Faith community leaders for taking time out of your busy days, PeaceHealth employees, Health Department, and all those others who are joining us. We have a lot of great ideas to share and so much compassion to give. I do think that gathering at times reinvigorates that and overcomes some of the isolation and fatigue that caregivers feel. So please continue to stay connected. Thank you all for being here.
I remembered one last thing. If there are any resources you need from us, let us know. And that we have a really great communications team that works so hard to figure out messaging and how to tailor the messaging for the needs that are in the community. So don't hesitate to reach out and we'll make sure to get you those resources as best we can.
Also, one other last tidbit, keep watching your email for news about town hall gatherings. There's some planning going on and faith-based groups will be the audience, we believe, for one town hall. So that's in the works. So watch for that.
Right. Thank you.
Thank you, everybody. Bye-bye.
Thank you.